Welcome to Olmsted Medical Center's Weight Loss Surgery Program Information Seminar. This seminar is free to view as many times as you would like, and all views are anonymous. Our mission? The delivery of exceptional patient care focusing on caring, quality, safety, and service. Our vision? To be the healthcare provider of choice in our service area by leading in quality, access, and service. Welcome. This seminar will take approximately 15 minutes. You may stop and start at any time in this video. This session will provide you with information about weight loss surgery, the process before, during, and after. After viewing this video, please submit your contact information if you are interested in the weight loss surgery program. First, we'll introduce you to our surgeons. Dr. Chandra has been with Olmsted Medical Center since 2006. He previously trained at Cleveland Clinic and Mayo Clinic. Dr. Chandra has been a surgeon for 30 plus years and is currently the Chief of Surgery for Olmsted Medical Center. Dr. Judah has been with Olmsted Medical Center since 2015. He completed his fellowship at the University of Iowa and specialized in Rou-en gastric bypass, sleeve gastrectomy, and other minimally invasive surgeries. Dr. Judah is a member of the American Society for Metabolic and Bariatric Surgery. Next, we'll talk about the rest of the team. The bariatrician is a doctor who is specially trained in issues involved in losing weight. They will review all of your health records and decide if you need medication changes, labs, or other tests before surgery. The purpose of this visit is to make sure you do not have any medical problems that may affect your ability to have surgery. We also have a psychologist. You will need to meet with the psychologist as part of the pre-surgical preparation. These visits are not only needed for insurance reasons, but also to find out if you are ready for weight loss surgery. You will build skills needed to support success after surgery. There is more information on the dietitians later in this presentation. The bariatric nurse coordinator acts as a liaison between patient and the surgeon who will be performing surgery. They also follow your progress to be sure all of the pre-surgical steps are being met along the way. The patient services representatives assist patients in making appointments and directing phone calls to the appropriate team members. Many patients that are seeking surgery have ongoing health conditions. Surgery can improve the quality of many of them and sometimes even resolve the condition. These are many of the obesity-related diseases that may be resolved with weight loss, such as migraines, obstructive sleep apnea, high blood pressure, type 2 diabetes, stress urinary incontinence, gout, and many other diseases. There are many other weight loss treatments, such as diet and exercise, but diet and exercise are difficult to maintain long-term, even in the most dedicated person. Medication is also an option, but medication is not a long-term solution as you cannot take it for long periods of time. And then there is surgery. Well, why surgery? Surgery is effective because it lowers the body weight set point and changes hormone signals in the body. Surgery is a tool in your toolbox. Surgery helps you lose weight and keep it off with other behavior changes. There are two types of surgery offered at Olmsted Medical Center. The first is the Rou-en gastric bypass. The second is the sleeve gastrectomy. More information will be given on upcoming slides. Bariatric surgeries work in two ways. The effects of having surgery are that it will reduce the amount of food you can eat and also changes the hunger and feeling of fullness. Rou-en gastric bypass. During the Rou-en gastric bypass surgery, a small pouch is created and separated from the rest of the stomach. The new pouch, which is about the size of an egg, is then attached to the lower portion of the small intestine. This pouch holds much less food and you feel full after eating only a few ounces of food. This reduces the number of calories and nutrients you can absorb from the foods you eat. On average, gastric bypass patients will lose approximately 70% of their excess body weight. Sleeve gastrectomy. During the sleeve gastrectomy, the surgeon removes about 75% of the stomach, including the part that makes the hunger hormones. The stomach is reduced to the size of a banana. This causes the feeling of fullness after eating a small amount of food. On average, gastric sleeve patients will lose 60% of their excess body weight. Typically, for both the gastric bypass and the sleeve gastrectomy, patients stay in the hospital for about 2 overnights and usually will require 2 weeks off from work. As with any kind of surgery, there are some risks. Risks of weight loss surgery may include infection, leaks, bleeding, blood clots, bowel obstruction, ulcers, or malnutrition. There may also be some side effects. Dumping syndrome typically happens with the Rou-en gastric bypass and is very uncommon with the sleeve gastrectomy. Dumping syndrome is caused by eating foods high in sugar and fat. Vomiting can be caused by eating too much, too fast, not chewing food well enough, an obstruction, a stricture, or an ulcer. After surgery, you will have multiple follow-up appointments with your surgeon and dietitian at set times as listed. It is important to include supplements into your daily routine after having weight loss surgery. When you meet with the pharmacist at OMC, you will go over the listed supplements and learn why you are needing to add these into your medication schedule. Who can have bariatric surgery? There are some general guidelines that we follow, but some insurances may have their own guidelines. These requirements come from the National Institutes of Health. You must be 18 years or older, elevated body mass index, have tried to lose weight in the past, stable mental health, and no drug or nicotine use. Before a surgery day is set, there are many steps that need to be completed prior to having surgery. Many of them include meeting with different providers that will ensure you are healthy enough to go forward with surgery, both physically and mentally. There is also some required testing, including a gastroscopy, an upper GI X-ray, an abdominal ultrasound, laboratory blood testing, a sleep medicine visit, and this testing should be done in the first 6 weeks of joining the program. Our business office will do the work in checking your insurance benefits. However, it is encouraged that you do a check as well. OMC will provide you with a checklist to use while calling your insurance company with specific questions and codes for weight loss surgery. What will I talk to the dietitian about? You will be required to meet with the dietitian monthly for 4 to 6 months in a row. This will help you to make dietary changes prior to surgery, as well as prep you for the changes that will be needed after surgery. Once a surgery date has been set, you will be required to have a pre-op history and physical by your healthcare provider to clear you for surgery. You will also meet with a preoperative nurse, a couple of visits with the surgeon, and follow a liquid diet 2 weeks prior to the surgery. Are you ready to commit to a successful surgery? C. Continuous canceled or no-show appointments may delay your surgery or prevent you from having surgery. So come to all the visits. O. Food choices need to change both before and after surgery to be successful long term. Overhaul food choices. M. There are so many responsibilities we have to family, work, and friends that we often put our needs last. To be successful, your needs must matter. Make myself a priority. M. Being active is an important part of losing and keeping weight off. Move more. I. Having the drive and focus to make the changes necessary in your life. Initiative to change. T. Prioritize yourself and your health. Take time for you. In order for the weight loss surgery team to help you get to your goal of surgery, there will be expectations along the way. Please be open and honest about your feelings, struggles, and concerns. It is very important that you keep your scheduled appointments and also meet your behavior goals along the way. Diet plus exercise plus lifestyle changes equals success. Weight loss surgery is only a tool to help you reach your weight loss goals. Making an informed decision. To help you decide if surgery is right for you and which of the surgery options is right for you, we have given you access to an online program. The bariatric coordinator will sign you up and send you an access code via email. Family and anyone in your support circle may view them also. Olmsted Medical Center will help you with the insurance process, and we can also discuss payment options. Why choose Olmsted Medical Center? We focus on the patient first, with a multidisciplinary approach for each individual. We are here to support and guide you during your journey, before and after surgery. What are the next steps? Fill out the form with your contact information located on the OMC Weight Loss Surgery website. A member of the team will contact you to follow up and answer any questions you may have. All inquiries are confidential. If you would like more information, please contact us using the numbers provided. Thank you for choosing Olmsted Medical Center. We look forward to caring for you.